Let's get our panellists up for the third panel of this morning, our third discussion, which is going to be about two of the guiding principles of this conference: ensuring equity and promoting rights. We've heard it a lot this morning, that it's a woman's right to have family planning, that women and girls around the world can choose when, whether and how often they'll have children, regardless of their circumstances. And to discuss that, we're joined on stage. Let me introduce first of all Ms. Michelle Bachelet, who's Under-Secretary General and Executive Director of UN Women. Rather obvious which one she is. Can I also introduce Khumbo Kachali, who is Vice President of Malawi and Minister of Health. Professor Dr. Ruhal Haque, who is Minister of Health and Family Welfare in Bangladesh. Mr. Soumana is Minister of Health in Niger. And last but not least, Justin Forsyth, who's Chief Executive of Save the Children. Welcome to you all. And start things off for us, Michelle Bachelet. I keep hearing this phrase, and perhaps it's the journalist in me that immediately says when something's a right, is it a woman's right to have family planning?
Well, of course. First of all, I want to say, Sarah, I'm so happy to be here. First, because I'm a woman. Second, because I've been a Minister of Health and a President of the Republic, and now as Executive Director of UN Women. I'm so convinced that women's rights, when we ensure women's rights and opportunities, everyone improves their lives, communities improve their lives, their families improve their lives. And of course, family planning. It's something that will permit us to make a reality some of the most important rights of a woman: the right to choose if she wants to have children or not, the right to choose if she wants to get married or not, the right to choose if she wants to have children, how, when, how she spaces it, how she really makes choices. That means that family planning can provide also access to information, access to services, health services, that will permit that those women and girls will make the best choices, informed and adequate choices. So I truly believe that women's rights are really expanded through family planning. Of course, through many other issues too. Second issue I want to raise is that when women do have access to family planning, and they can really ensure the right for sexual and reproductive health and right, women have a tool that will allow them to enjoy other women's rights, and they can fully participate in their societies, economically, politically, socially. On the other hand, when we see girls, and I heard you asking some of the former panelists, do we really save lives? I mean, when we think on girls and young women, we know that all kinds of unsafe abortions or complications in pregnancy or in childbirth are really leading the cause of death for enormous numbers of girls aged 14 to 19 years old. So we know that through access to family planning and to sexual and reproductive health services, we will be saving life. But we not only will be saving life, because we will be empowering them. We know that if girls can delay their first pregnancy, they can finish school. They can also diminish the rates of HIV infection. They can delay the early marriage, and so on. So we're really empowering women, as girls, as adolescents, and in that sense, we're improving everyone's life.
Khumbo Kachali, Malawi, like so many African countries, you have an incredibly young population. And we were hearing earlier about the number of young girls, 1 in 3 under 18 girls in Sierra Leone gets pregnant. What are you doing in Malawi to ensure, to allow young people to have access to contraception?
Thank you very much. To start with, in Malawi, we are saying no parenthood before adulthood. In this Now, Malawi government has taken note with great interest the importance of the role family planning plays in stabilizing the growth of our economy and contributions to improve the health of its citizens. And this particular improves the quality of the lives of the women and the girls in our country. And now the government therefore wishes to embrace family planning as a strategy to achieve development goals And we hereby commit ourselves as a Malawi government to raise contraceptive prevalence rate up to 60% by 2020, which focuses in those ages between 15 and 24. Now, Malawi will do the following immediately. Approve the national policy on population before the end of this year, that's 31st December. Raise the legal age of marriage to 18. I am ashamed to tell you the legal age that is there in the Constitution now. Strengthen the institutional arrangement to deliver effective policy leadership for population and family planning. We will also create a family planning budget line within the main drug budget as a standalone budget in our national budget. And we'll demonstrate the accountability of the resources made available to us. However, in spite of all our best effort reflected above, we acknowledge that we still have some funding shortfalls. In this regard, I wish to solicit funds, support from our partners to bridge the gap. Our program development and sexual deliveries from Malawi are as follows. We will deliver a comprehensive sexual and reproductive health program for the youth in this coming year. That's 2013 to 2014. Increase coverage of the services through expansion and more efficient public-private partnership for 2013 to 2014. Increase community access to all family method through community structure. This will involve the traditional authorities, the chiefs. These are our firm commitments in terms of policy, political will, financing, delivering of family planning services. We will ensure all this with our motto of saying no parenthood before adulthood.
Can I just be clear? You've got a very firm set of commitments there. Are those funded or not funded?
As of now, we have budget line within our own means of health. But from now onwards, it will be a standalone budget line. So we are asking for contributions towards this standalone budget.
So you've got the will, you know what you want to do. You
exactly.
Just give us the money, I suppose.
Thank you. Thank you.
Okay, there's a different... Professor Haque, there's a different challenge for you in Bangladesh, which is you have, I mean, there's any number of challenges, but let's take one, which is you have densely populated urban areas. Talk about the difficulty of getting family planning into those areas, if you will.
Thank you, Sarah. It's nice to meet you in person, and especially coming to save lives for especially 120 million fewer unwanted pregnancies in future. And especially thanks to UK government and Bill and Melinda Gates for arranging this. Yes, Bangladesh is totally committed in existing quality family planning services to every corner of the country, to every eligible couple, irrespective of their social, cultural, political, and other entity. We have made significant progress in the family planning services in the recent past. The TFR has declined to 2.3. The contraceptive prevalence rate is already 60. The success made possible through working efficiently with our partners. These are government, non-government NGOs and other NGOs. However, we have many miles to go. Currently, family patterns are uneven. High levels of among uneven urban poor and poor rural women with a geographic dominance to the eastern Bangladesh and hard to reach areas. Currently, full range of family planning commodities are not evenly accessible to the urban poor. May I also mention that the family planning services for every commodity is freely delivered, to whether it's delivered by the government or by the NGOs. And the government of Bangladesh is committing approximately $400 million to provide coverage of the family planning services to 39.4 million eligible couple for 2021. We aim to further reduce the total fertility rate to 2 and increase the contraceptive prevalence rate to 72% by 2016 and 80% by 2021. We have committed to eliminate geographical disparity, inequality between urban and rural, rich and poor, ensuring rights and addressing the high rate of adolescent pregnancies. To do this, we use our network over 12,000 community clinics set in the rural areas for every 6,000 people, and we, as well as innovative services delivery to target the urban poor, hard-to-reach areas, and BCCI approaches, and the use of ICT, upgrading the 1/3 of MNCH centers to provide adolescent-friendly sexual and reproductive health services. We will increase the CPR to low-performing districts and geographical areas, as I said, in the eastern part of the country, and urban slums by 2021, to at least at par with the national average. We are committed to quality care, quality information, and counseling services cared for with dignity, informed consent for method mixing and methods of choice, ensuring the follow-up of services to some of the issues taken care with due importance to our program. We have robust system in place and ensure these issues be addressed. We are totally committed, and I believe firmly that we will achieve it soon. Thank you, sir.
Thank you very much, Professor Haque. We might try to come back at a later date to this idea of the CPR, the contraceptive prevalence rate, and its importance. But we've got a little technical challenge for you now, because on your desk you've got a headset. If you speak French, don't worry. But if you would like a translation from the French, then do please put your headset on. There's the simultaneous translation numbers, because we have our next speaker now. Soumana Sands is going to, and Soumana is Minister of Health in Niger. He's going to tell us how in Niger they're educating the men to take the decisions on family planning, and of course the significance of that. Mr. Sands.
Merci.
Thank you very much. The success of this activity is translation of all commitments in terms of policy, finance programs, to achieve concrete results. The School of Husbands is an experiment which involves large areas of our country. As you know, we have a population growth rate which is very high, 3.3%, which is one of the highest in the world.
N'est pas en fait une école classique.
Il
n'y a pas de classe, il n'y a pas d'élèves, il n'y a pas de maître, il n'y a pas de hiérarchie. Mais il y a une approche politique et pédagogique qui a pu amener les hommes qui ont le pouvoir de décision. C'est à eux qu'appartient la décision si la femme doit aller au centre de santé ou pas. Donc c'est ces hommes que nous avons organisé un regroupement dans le cadre d'échanges libres où, vers la fin, la féodalité qu'ils exerçaient sur les femmes s'est transformée en une approche beaucoup plus pédagogique pour amener ces mêmes hommes à convaincre les autres hommes à accepter à ce que leurs femmes aillent au niveau des centres de santé pour la planification familiale. Donc ces hommes sont transformés en acteurs pour la promotion de la planification familiale et ces activités qu'ils sont en train de mener. Nous avons vu des résultats extraordinaires. En 2006, nous étions à 5% de taux de prévalence contraceptive. 2 ans après cette expérimentation, nous nous sommes retrouvés à 16%. Pour l'avoir seulement expérimenté au niveau de 2 régions. Un engagement politique est en cours d'élaboration pour que cette activité soit portée à l'échelle à partir de 2013. Donc nous pensons qu'à travers cette initiative, nous pouvons en 2020 atteindre l'objectif de 50%.
Soumana Sands, thank you very much. Just for listening to that final point, which is reaching the 50% contraceptive prevalence rate by 2020. Look, a final question now to Justin Forsyth. Well, final question. We'll hopefully have a few minutes for chatting. But Justin Forsyth is from Save the Children. And Save the Children, you're known for the work you do. You're not known for family planning. And you are doing making a focus on that now. Why?
I think because, as we've heard today, family planning saves lives. It saves children's lives, it saves adolescent girls' lives, and it saves women's lives. I travel a lot to many of the countries where we have ministers of here today, and I know that we're making, in all of those countries, huge strides forwards in reducing the number of children that die from preventable illnesses because of the health services that have been put into place, because of the vaccination programs, even new initiatives on things like diarrhea and pneumonia. But we know that we won't accelerate that progress further unless we address this issue of family planning. When I was in Sierra Leone just a few months ago, and I know we heard earlier from the Minister of Sierra Leone, I visited a community right on the bay area of Freetown in Crewe and Susan's Bay. And there were dozens of girls, and we met one girl there called Juliet. And at the age of 12, she was forced to have sex with an older man. I mean, that happens in Britain, it happens in Sierra Leone. She got pregnant. She then had, when the baby was born, 3 days of labor. She's far too young to have a baby. The baby died. And then, like so many teenage girls, she got a fistula because her body wasn't ready to have a baby. And then for the next year, she was too embarrassed to get treatment for the fistula. She was outcast by her community. She was worried about the consequences of the fistula. It's a very embarrassing condition and seen as something to shun. And she has a permanent limp now. She's 14 now. And in a way, the whole of her life could be blighted by this unwanted pregnancy, the baby tragically dying. And there's 1 million of Juliets every year who either get injured, and 50,000 of them who die in childbirth. So that's why Save the Children and many other of my colleagues from NGOs who are here in the day, well, not just from NGOs in northern countries, but in developing countries. We heard from Theo earlier, who does excellent work on all of these issues, who are campaigning and working on the ground to make sure that there's access to information, there's girls' education, that we also address some of the practices that lead to girls being married too early, but also we have access to contraception. And for us, whether it's an adolescent girl or a mother who can't space her children and therefore has too many children, many of whom are malnourished, and again, many of whom then die, it's an issue of life and death, and that's why we focus on the issue. And like many of the people here today from governments, many NGOs are also making pledges today, and as Save the Children, we wanted to make a pledge to fund and train nearly 250,000 health workers on the front line, who are often the people, often women, who make the difference in this, and also to help fund 250,000 of girls going to school and up to 50,000 women teachers. Again, girls' education, as we heard earlier, is such an important part of getting the change here.
Okay, Justin Forsyth, thank you very much. I just want to ask you about this. We've heard it a lot, and I think it's important because a lot of people immediately understand CPR, contraceptive prevalence rate. Michelle Bachelet, can you help us a little bit on this one? Because we've got this range of, Soumana stands making the point that at one stage it was 5% in Niger, and then we had the hope of 80% in Bangladesh. How significant is that rate, and how much should be sort of hung on it?
Well, I think we should have universal access, and it should be 100%. But I'm very...
And that's all it means. It means access to, rather than... So the dream for you is 100% CPR?
Yes. It's 100% women that can ensure to make the choices.
Okay. But the CPR, I just wanted to nail down that it is purely access to, irrespective of use. Because there's also, obviously, there's all sorts of other barriers, I suppose, to use.
No, I think they have to have access that can really be a reality and that will transform women's life. That's so we need to work, of course, for 2020 to get to 120 million women that surely can really have access to family planning in a real way. But on the other hand, from our part, from UN Women, we need to continue working, expanding and ensuring women's rights, through expanding their capacities on political and economic empowerment, because I believe all of these issues are intertwined. Here I am, and very happy with 4 colleagues, but also we need to ensure that we have more women in the places where decisions are being made, where budgets are being discussed, So all of these decisions and policies can be a priority and can be a reality. So I will continue as UN Women working in all of these issues and with UNFPA, WHO, and so on, and UNAIDS expanding women's rights and women's access through family planning and through many other activities to ensure women's rights.
Okay, can I just ask you, Professor Haque, just a quick thought, because we've not got too long, but on this, you talk about the difficulties of getting in densely, the urban poor, reaching them. That's not a question of funding, is it?
There is a question of funding. There will be a gap, as you said, that we are committing 400 million, but I think there will be a gap of over 40 million per year, and we will be needing some funds, but we are already committing from the government 400 million, but there will be still some funds will be needed. But one of the points I would like to make that you are saying about CPR, I think for our countries that we are going to deliver, two of the important points is the dropout rate. The people who drop out because they come and then they don't continue for the rest. So I think it's very important. Also, it's very important. They drop
out because what?
Because they don't get it, because they don't have the access and they are not enough committed, etc. I think that's a very important thing.
So, I mean, and just to unpick what that means, if you're required to take a contraceptive pill every day know that you can have those drugs every day for the years going forward, so there are clearly problems of that.
It has to come down. The dropout rate has to come down. And the unmet need, that's another thing, because sometimes we cannot get them. That's what she's talking about. 100% has to be available. So we have difficulty in reaching. Some of the country, in my country, is about 12%, and we would like to reduce it to 7%. So these are very important issues, and also to improve the technology. For the help of the technology, help them improve these things so that we can really reach
the actual
what
products
she is
themselves.
saying.
And we will be talking about some of the products later this morning, so we'll get into some of the detail of that. But ladies, gentlemen, for the moment, Michelle Bachelet, Khumbo Kachali, Professor Haque, Soumana Sands, and Justin Forsyth, thank you.